Today we will discuss top 4 vitamins every diabetic must eat. Living with diabetes is not easy. Constant blood pressure checks, meal planning, and the fear of complication can feel overwhelming. But here is the good news. The right vitamins can help support your body in ways you never imagined. Let's get started. Number 1. Vitamin D. First on our list is vitamin D, often called the sunshine vitamin. This vitamin is a powerhouse when it comes to managing diabetes. If you are living with diabetes, there is a high chance you might be deficient in vitamin D. Vitamin D plays a critical role in how your body processes sugar and produce insulin. Studies have found that low vitamin D levels are closely linked to insulin resistance. What does that mean? Your body struggles to use insulin properly, which can lead to higher blood sugar levels. Moreover, vitamin D deficiency can impair the functions of beta cells in your pancreas, which are responsible for producing insulin. Low levels of vitamin D can increase inflammation, which worsens complications like nerve damage, heart diseases, and kidney issues. Research published in the Journal of Clinical Endocrinology and Metabolism found that supplementing with vitamin D can significantly improve insulin sensitivity, making it easier for your body to regulate blood sugar. Another study from Diabetes, Obesity and Metabolism showed that vitamin D can enhance beta cell function, helping your pancreas produce insulin more effectively. Moreover, vitamin D is also a natural anti-inflammatory, which means it can help reduce the chronic inflammation. This can lower your risk of complications like neuropathy and cardiovascular diseases. It also supports bone health, an important consideration for diabetics. Now here is how to get this vitamin. The best source of vitamin D is sunlight. But let's be real, most of us don't get enough sun exposure, especially if we live in a colder climate or spend most of our time indoors. That's where supplements come in. Experts recommend taking 1000 to 4000 international units of vitamin D3 daily. This form is the most effective at raising and maintaining your vitamin D levels. Number 2. Magnesium. Second on our list is basically a mineral called magnesium. Magnesium plays a crucial role in over 300 processes in your body, and many of which directly impact how your body handles blood sugar. It helps regulate glucose metabolism and improve insulin function. Studies show that people with diabetes are much more likely to have a magnesium deficiency. Low magnesium can make your insulin resistance worse, increase inflammation, and even increases your blood pressure. So what happens when you get enough magnesium? A research published in Diabetes Care found that magnesium supplementation significantly improves insulin sensitivity, which means your body uses insulin more effectively to lower blood sugar levels. In another study from the American Journal of Clinical Nutrition showed that magnesium can also help reduce inflammation, an underlying issue that contributes to diabetes complications like heart diseases and nerve damage. Moreover, magnesium has been shown to help lower blood pressure, a common problem for diabetics. High blood pressure puts extra strain on your heart and kidneys, which are already vulnerable when you have diabetes. So by maintaining healthy magnesium level, you are not just improving your blood sugar, you are protecting your whole body. How to get it? While magnesium is found in foods like spinach and almonds, it is often hard to get enough from diet alone, especially if you have diabetes. So you have to take supplement. For the best results, look for magnesium glycinate or magnesium citrate, which are easier to absorb. A daily dose of 200 to 400 mg is ideal, but always check with your doctor to make sure it's right for you. Number 3. Omega-3 fatty acids. Third on our list is omega-3 fatty acids. These healthy fats are not just good for your heart, they are essential for managing diabetes and protecting your overall health. Omega-3s help combat inflammation, which is a major player in both diabetes and its complications. Chronic inflammation can worsen insulin resistance, damage blood vessels, and increase the risk of cardiovascular diseases. Omega-3, particularly EPA and DHA, act as natural anti-inflammatory compounds. helping to reduce this harmful process of inflammation. Moreover, people with diabetes are 2 to 4 times more likely to develop heart diseases, and omega 3s can help lower that risk. They reduce triglycerides and improve your overall lipid profile. According to a study published in Diabetes Care, omega 3 supplementation can significantly lower triglyceride levels. Omega 3 also play a role in preventing blood clots and stabilizing heart rhythms, both of which are crucial for diabetics prone to cardiovascular events. Some research suggests omega 3s may even improve insulin sensitivity, although this effect may vary from person to person. How to get omega 3? The easiest way is through supplementation. Look for high quality fish oil that provides a combined daily dose of 1000 to 3000 milligram of EPA and DHA. If you prefer to get your omega 3s from food, focus on fatty fish like salmon, mackerel, trout, and sardine. Aim for 2 servings of these fish per week as per recommended by the American Heart Association. For plant-based sources, flax seeds, chia seeds, and walnuts are good options. You might be wondering, are there any risks? Omega 3 are generally safe, but taking very high doses can thin your blood. So if you are on blood thinning medications, talk to your doctor first. Number 4, vitamin E. Finally, let's talk about vitamin E, which is known as a powerful antioxidant. Vitamin E protects your cell from damage caused by free radicals, those harmful molecules that increase oxidative stress and fuel complications in diabetes. In diabetes, high blood sugar levels create oxidative damage or oxidative stress. This stress doesn't just harm your cells, it contributes to inflammation, damages blood vessels, and accelerates the development of complications like heart diseases, nerve damage, and kidney problems. Vitamin E neutralizes free radicals, reduces oxidative stress, and helps your body from further harm. Studies suggest that it helps improve endothelial function, a key factor in maintaining healthy blood vessels. For diabetics, this is crucial because endothelial dysfunction is a precursor to cardiovascular diseases. A study published in Diabetes Research and Clinical Practice highlighted that vitamin E supplementation can significantly reduce markers of inflammation, such as C-reactive proteins in individuals with diabetes. Additionally, vitamin E may support better glycemic control. So how can you include vitamin E in your daily routine? First, consider your diet. Foods rich in vitamin E include avocados, almonds, sunflower seeds, and spinach. However, most people don't get enough vitamin E from food alone, especially diabetics who may need higher amounts to combat oxidative stress. This is where supplementation becomes essential. Experts recommend a daily dose of 2 to 400 international units of vitamin E. Is there any risk? It's generally safe, but excessive vitamin E intake, especially in supplement form, can increase the risk of bleeding, particularly if you are on blood thinning medications. Always consult your healthcare provider before starting any new supplement regimen. Alright, thanks for watching. Have a nice day. Allah Hafiz.